And again, thank you everybody for joining us. A couple of things I want to make you aware of before we begin the presentation today. One is some of the information you're likely to hear in this presentation is probably going to be helpful in your own life and how you look at things and how you deal with painful memories and experience. And so for that aspect of it, I'll just say you're welcome. And also during this talk, I'm going to plant an idea in your head that probably wasn't there before that you'll probably think about every time you see or hear about a certain object. And so for that aspect of it, I apologize. So let's go ahead and get started. So we're going to be talking about acceptance and commitment therapy, or it's also known as ACT. You don't pronounce it ACT, that's the American College Testing, just ACT. So if you want to be inside the club, when somebody's talking about acceptance and commitment therapy, you say, oh, you mean ACT. ACT is based on relational frame theory, and we're going to get a little bit into what that is. But in the presentation we're going to be doing next month in cognitive behavioral therapy, we're going to talk about the core beliefs that we carry around in our mind, and that black box is something that we filter all of our conscious perceptions through. With that, those conscious perceptions then become kind of unconscious and automatic processes. So the black box in your head, your list of experiences and thoughts and expectations, those result in thoughts, feelings, and behaviors that you experience and that you exhibit. And relational frame theory seeks to decode that process by which these core beliefs are created, they're refined, and they're altered over time. Now back to ACT. ACT is listed within the National Registry of Evidence-Based Programs and Practice and is considered an evidence-based practice by Substance Abuse and Mental Health Services Administration of the U.S. Department of Health and Human Services. So this is something that has been vetted through extensive peer-reviewed and outcome-based evidence. The American Psychological Association lists ACT as a well-established treatment having strong research support for the treatment of chronic pain. It's also considered to have moderate support for the treatment of depression, anxiety, as well as obsessive compulsive disorder. So it's not a panacea for everything, but particularly for chronic pain, it is one of the strongest evidence-based practices for treatment. ACT is considered a third wave behavioral therapy approach. So if you look at the different developments throughout the years in psychology of these different approaches, the first was behavioral therapy, what you typically think of as a rat in a Skinner box and learning by way of experience. The second wave was cognitive behavioral therapy, which attempted to integrate the concept of mind or our thoughts within the emotions and the reactions that we experience. And this third wave approach, which includes acceptance and commitment therapy, it also includes dialectic behavioral therapy and mindfulness-based cognitive therapy. These third wave approaches attempt to broaden attention to the psychological as well as the contextual and experiential aspects of our world. So in other words, you're trying to integrate not only your behaviors, but also your thoughts and the context in which those thoughts occur. Stephen Hayes, who developed ACT, in talking about the appeal of it, says that it's personally relevant to people who are facing issues of their own. I know that as a therapist, it is difficult often to present a particular therapeutic approach if it's not something that you have at some point in your own life utilized. And ACT, or acceptance and commitment therapy, has aspects that you can use every day in your life. It's something that, for my own experiences and painful memories, it's something that has given me a great deal of peace over time. And as a result, it helps me as a practitioner be able to extend this to patients that I work with. And so if I can see value in it myself personally, I also can see how a patient can benefit from that. So it doesn't feel false or hollow because of that ability to experience. It provides an evidence-based framework and allows you as a therapist to create things on the fly. Stephen Hayes has said you're going to find your own work within this work. So in that respect, ACT is as close to an open source approach as you'll find in psychology. Many of the other approaches that I mentioned, dialectic behavior therapy, for example, or mindfulness-based cognitive therapy, these are approaches that require extensive certification or credentialing in that orientation. It requires workshops and the blessing of the copyright holders. It can be very expensive to get credentialed in those types of therapy. The developers of ACT went a very different direction and said, if this works for you, use it. If you need to modify it for the patient that you're working with, modify it. And if you don't mind, let us know what works, because we want to keep adapting and adjusting this. And so, in the real world, I think being able to adapt and adjust an approach to the patient that you're working with is necessary in most cases. And I think as you are able to improve on a particular therapeutic approach by your own experiences, it gives you more of a crowdsourced way of bringing in ideas. And from that standpoint, it's a very advanced way of doing therapy. The basic premise of relational frame theory is that human behavior is largely governed through networks of mutual relations that are called relational frames. These relational frames form the core of human language and cognition, and it allows us as human beings to learn without requiring direct experience. In other words, you can learn through language. Someone else can teach you something by talking about it. You never have to be burned by fire as a kid to know not to touch it, because we tell our children, don't touch it, that's hot. In terms of the outside world, this is an invaluable tool. In terms of our own inner experience, however, these verbal rules can restrict our lives in fundamental ways, and we'll talk about that shortly. Relational frames can be frames of coordination. So in other words, when it comes to defining concepts, we can define things as the same as, similar, like. Relational frames can be temporal or causal. We can say that something happened before or after something else. If-then statements, something that is the cause of something else. These are relational. You are relating concepts in the form of a temporal relationship. One that I think our minds automatically jump to frequently is comparative or evaluative relational frames. In other words, determining is something better than, worse than, bigger than, faster than, taller than, more desirable, less desirable. Your brain does this automatically. There are others that are called deictic frames. These are frames that are in reference to the perspective of the speaker. So in other words, if somebody says I, you, we, they, them, us, there, here, the meaning of that is dependent upon knowing the individual who is making that statement. It's dependent upon the context in which the word is used. Same thing for spatial frames. When you talk about near, far, close, distant, these are automatic things that our brain generates, and it depends on the speaker when it comes to being able to determine where that lies. As you look at the picture, for example, that is on the screen, your brain deconstructs and reconstructs the components of this image in terms of language. That's a subconscious process. You look at this picture and you see younger, older, beside, taller, shorter. All of these things are aspects, are qualities of the image. And if the image was presented in color, you would be able to name the colors and the relationship between them. So these are things that your mind automatically does. Your mind can relate any two words or concepts or constructs through these relational frames. Indeed, there's some psychological tests that we utilize within intelligence testing that looks at the developmental sophistication of an individual's ability to relate two different words. It tends to start out with a couple of very simple ones. So how are a cat and a dog alike? Your mind is able to come up with those relations. It goes to very difficult ones, though, things like how are a crown and a badge alike? That's more abstract. And so as we develop mentally, over time, get more sophisticated cognitively, we are able to develop more interesting constructs from the standpoint of these relational frames. And again, these relational frames are the way in which our internal experiences, our core beliefs that allow us to experience things that aren't happening right now, are coded within our brain. As you're sitting here, you can travel backwards in time, you can travel forwards, you can think about things that happened in the past, you can look forward to things that you're going to do or planning on in the future. You can create and react to mental constructs outside of the here and now existence, and you react psychologically and emotionally to those mental constructs. But as I said, these internal verbal rules can be artificial walls that we create around ourselves as well. Think of an invisible fence for a dog that has learned that they can't go beyond that point. Sometimes these verbal rules kind of restrict us from that standpoint, that we don't go beyond that point, which is an artificial creation. And it doesn't allow us to create our true selves. It doesn't allow us to reach our full potential when we artificially limit ourselves in that way. To demonstrate that what I mean by language being the code that runs in your mind, I want you to do a little exercise here. I want you to think about a lemon. Think about cutting into a fresh, cold, juicy lemon that you just took out of the refrigerator and taking a big bite out of that lemon. Now, as you concentrate on that, you're probably experiencing a physiological reaction to the set of rules you have in your head about lemons, those relational frames that I have through a series of sounds that I made with my mouth caused you to have a salivary response. And that's because we all share a common definition, concept, or core of relational frames that goes beyond just the experience of the words. Words are the code that dictate our actions, our thoughts, and our emotions, and our concept of self. And as you can experience, that salivary physiological response in coordination with the thought that you had about a lemon just demonstrates that it's not just a thought. You also react to it emotionally and physiologically. Mindfulness is a big part of what we're going to be talking about as well. And this is an ancient Buddhist practice, but you don't have to be a Buddhist to practice it. You do have to make the differentiation between, for some individuals, this as a religious practice versus this as a cognitive practice. And I have encountered that a couple of times within my professional experience, where someone says, I don't really believe in Buddhism, so I don't want to really talk about mindfulness. But in a more secularized experience in the Western tradition in the US, you're more likely to practice mindfulness in a more secularized type of fashion. Within our Western culture, mindfulness has actually been described as in a number of different terms that I think are a little bit more appealing to our Western audience. So calling it attentional control training, for example, is really just being aware of where your mind is going, paying attention to what your mind is thinking of. Kabat-Zinn really focused on the aspects of this that are useful for stress reduction. And mainstream mindfulness is also a term that's been utilized. You know, at its heart, the concepts of mindfulness remain the same. It's being aware of and living in the now. Mindfulness is a form of awareness. It's available to anybody at any moment. It's just paying attention in a particular way on purpose, in the present, and non-judgmentally. It's not mindlessness, and I often think that people think of mindfulness in this way. It is not attempting to clear your mind of all thought, because quite frankly, that is a pretty much impossible thing to do. In the context of ACT, it's clearing the clutter. It's clearing out the things that are not here and now. It's being aware of your thoughts as a product of your mind. It's making you aware of the degree to which you invest energy and emotion in those thoughts, or you choose not to invest energy and emotion in those thoughts. It is both a process and an outcome. So it's mindfulness practice, it's mindfulness meditation, and the outcome, which is mindfulness awareness. Mindfulness practice is a process through which you achieve mindful awareness. The model of psychopathology when it comes to ACT, the reason that people get stuck in these negative loops, is represented within the various points here, which result ultimately in what's in the center of that icon, which is psychological inflexibility. If you are inflexible because various aspects of the world are not going to bend to your will, you're probably going to be unhappy a lot of the time. And we talk about that in terms of cognitive behavioral therapy as well. If you expect the world to give you what you want when you want it, you are often going to be angry and frustrated because the world is really not existent to make you happy. It is what it is, and you are what you are, and the two things don't necessarily match up. So the world doesn't exist to make you happy. There's a piece of bad news for you today. But if you anticipate that and you accept that and you are aware of the fact that there are some aspects of the world that you cannot change, you spend less time and less frustration and less anger being upset that the world's not giving you what you want right this minute. If you look up at the top of this icon, being stuck in the past, being stuck in a negative future, I mean, this is what you often see when people are depressed or anxious. They are reflecting back on negative experiences that they have had in the past, or they are dreading and emotionally distressed about what may happen. Conceptualized self at the bottom of that icon, the attachment to the conceptualized self, that is the definition that I am fill in the blank. I am quiet. I am whatever you define yourself by in that internal language. That attachment to that definition of self becomes a rigid and inflexible box that prevents you from stepping across boundaries. And those boundaries may represent absolutes of our physical existence, but more often they're arbitrary and artificial. We've created them through our own internal language. So if you say, I'm not a very outgoing person, I'm not comfortable talking to strangers, well, you can bet that going up and talking to strangers is something you're not going to spend very much time doing. You have defined yourself in a way that now limits your experiences. The conceptualized self is full of content. It's the story of you and your life that you have been accepting, and it contains all the thoughts, feelings, bodily sensation, memories, and behavioral predispositions that you've integrated into a stable sense of who you are. But the conceptualized self has the ability also to trap you within your suffering, because that story provides reasons for your actions. It provides coherence for your experiences. It's kind of comfortable because you know who you are and you know your definition of self, but it's also very limiting because you perceive things through that filter. The interesting part of this is you have the ability to rewrite that code at any point. And so that's what we're going to focus on from the standpoint of what's called the ACT hexaflex. That is the icon that you see represented there, because you have those 6 major points that all in coordination result in psychological flexibility, being able to adapt. The goal here is to increase your psychological flexibility, to shift your attention away from fear and avoidance to working on, if we're talking about our patients, working on what they most deeply care about and what they want in their lives. And I'm going to go through each of these points around the model and talk about them. But I do want to start out with one of the simplest and yet probably more complex aspects first, and that is the process of diffusion. So we've been talking about relational frame theory and the language or the code that runs in your head and influences your thoughts, your feelings, and your actions. One of the most startling concepts that gets introduced in this theory and in this therapy, and I think it's only startling if you've never thought about it, and many people honestly haven't ever considered this, is the thought that you are not your thoughts, that you have this running sense of language inside of your head that are your thoughts, that are your memories, that are your anticipations, that are your perceptions, and they are separate from you as a person. The fact that you as a person have the ability to independently observe the thoughts that your brain is producing means that you have a sense of self that is separate from your thoughts. Now that is a very liberating thing when you think about it, because it allows you to be aware of and monitor your thoughts. And from the standpoint of diffusion, it allows you to decide whether or not a thought is particularly helpful at any given time. So again, taking a step back and observing your thinking instead of simply being your thoughts. So when you have a negative thought, being aware of the fact that that is simply a thought. One exercise that we often use with this is basically picturing yourself sitting by a stream, a literal stream of thought, and leaves floating by on that stream. You don't really have control over what leaves float by, but you do have control over whether or not you pick up and examine a leaf in detail and make it a part of who you are. That stream of thought allows you to be aware of, to step back and observe your thinking. And at any given moment, if there is a thought that comes up, you can just kind of tell your brain, well, that's interesting, thanks for thinking that, and wait for the next thought to come along. You don't have to have the same emotional reaction that you have always had when that negative thought occurs. So it's really learning to see your thoughts for what they are. You have in your brain this chattering monkey that is always throwing thoughts at you, and you don't have control over what thoughts are coming out. You do have control over how you relate to and react to those thoughts. And so it is diffusing from unhelpful thoughts. Anything that is self-limiting or harsh self-criticisms or negative experiences, you can't make them go away, but you can decide how to react to them when they occur. Acceptance is a big part of it, and again, this is one that I think people often misinterpret when you bring up the term acceptance, because acceptance doesn't mean, suck it up, little man, put on your big boy pants and let's get on with life. That is not what acceptance is about. I think most of you have probably heard at one time or other the serenity prayer. God, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. That's what we're talking about when it comes to acceptance. If you are a hiker and you like hiking on mountain trails and a big rock has fallen into the middle of the trail that you normally hike, well, you know that rock is hard. No reasonable person is just going to stand there and beat on that rock with their hands that has fallen in the middle of the trail. Any reasonable person is going to figure out a path around the rock because we accept that rock is hard. It's the same thing when it comes to acceptance of things in our life that we cannot change. If you spend a lot of time beating your hands up against the rock, that's called suffering. The rock that exists is pain, but you beating on the rock and you trying to make the rock not be hard, that's suffering. So if you spend extensive amount of time suffering, you're wasting your energy and wasting your time. So it's not saying accept everything. If it's raining and you don't want to get wet, get out of the rain. Use an umbrella, build a shelter, live somewhere that it doesn't rain very much. My mom visited a place in Peru once where they get very little rain. She said she visited a church that did not have a roof on it. She asked, what do you do when it rains? And they said, it doesn't. They get about 4/1000ths of an inch of rainfall per year. So if you really don't like rain, you should be living there because it doesn't rain there. But human beings are also really good at making changes to things. There are people who live there because they dig wells, they build pipelines. As human beings, we change things to make our lives easier, more accommodating, or more comfortable. So it does mean change the things that you can. But for those things you cannot change, instead of fighting them, resisting them, or running for them, or even getting overwhelmed by them, ACT tells you be open to them. That experience is what it is. Simply let it be. It doesn't mean liking it, doesn't mean wanting it. It just means making room for it, not devoting effort and energy into trying to make it go away, because it won't. So you walk around the big rock. You don't spend a lot of time pounding on it. All right, I want everybody to come back to me for a moment here, because as a group, I've got an exercise for you. I'm going to need my stopwatch out on this one. I want everybody listening to me to think about something for about 15 seconds, and I'm going to be relatively quiet during that time. I want you to form in your mind a scene involving a yellow Jeep. All right, I'm starting the timer here for 15 seconds. A yellow Jeep. Think about a yellow Jeep. Think really hard about a yellow Jeep. Okay. Now, I don't know what image you formed in your mind, but here's my yellow Jeep. It's rainy here today. I would rather be in this place, in this Jeep. Before that 15 seconds, how many of you were thinking about a yellow Jeep? Over the past day or even the past week, how many thoughts about a yellow Jeep did you have? Yellow Jeeps exist. They certainly did before now, but they didn't occupy your thoughts. But when you focus your mind on that, that's all you think about. Now I've got a different exercise. For the next 15 seconds, I'm going to be quiet, and I want you to sit there and focus all of your mental powers to not think about a yellow Jeep. Pretend they don't exist. Completely clear your thoughts of a yellow Jeep. Begin now. I don't think we need to go the full 15 seconds, because I'm betting that most of you, had a mental image, at least for a moment, of a yellow Jeep. The two people sitting in the room are grinning at me because they both had yellow Jeeps driving around there. I mean, you're all really bright people. You've got specialized training. You've got dedication and commitment to go through training programs and requirements that seemed arbitrary and inhumane at times. But with all that mental horsepower, you still can't stop yourself from thinking about something. I'm just illustrating here that when you try to eliminate a thought, it's an exercise in futility. We can't do it, and we can't expect our patients to do it. Our human brains don't operate that way. When you try not to think of something, you are by definition thinking about it. So if you have a yellow Jeep in your head, you have to open up and make room for it and try not to push it out. Doing so keeps it within your consciousness. And the more you think about something, the more automatic it becomes. Again, this goes back to chronic pain and also to pain and suffering. The difference between pain and suffering. Pain itself, whether it's physical or emotional pain, it may be unavoidable, but the suffering associated with it is secondary. And we know that struggling to get rid of the pain often leads to more suffering. If you've had some past trauma, some negative experience in your past, there is psychological pain associated with that trauma. Acceptance in this context means acknowledging that the pain from that trauma is a part of who you are. You cannot erase what has happened in the past, but you can decide how that past pain will or will not dictate who you are now and what you do now or in the future. It is hard to stay focused in the moment. We all get caught up in thoughts and we lose touch with the world around us. But being psychologically present and connecting with or engaging with whatever is happening now is what is important. You know, our brains have the capacity to operate on automatic pilot while we are thinking about the past or thinking about the future, while we take these mental vacations. When you're driving your car, your brain is taking mental vacations. You get absorbed in thoughts about the past or thoughts about the future. I'm betting that even during this riveting presentation, each and every one of you at some point has had thoughts outside of the here and now pass through your mind. It's what your mind does. You can't stop it. But you can be aware of it even as it's happening. This is mindfulness, an awareness of the degree to which you're here and now. It doesn't mean clearing your mind of all thoughts, only that you want to focus on those thoughts that are important to be aware of in the present moment. It's what I like so much about that simple graphic, is being out in the world, and are you being aware of the here and now, or is your mind completely cluttered with all of these other thoughts that you have at any given point? The values aspect is, again, knowing what matters. Values are intentional qualities that help you join together a string of moments into a meaningful path. If you decide to go east, you can use a compass, and that compass will guide you. And then you're traveling in a given direction by intention. But can you ever get to east? Directions are like values. They're not goals. They're something you do, or they're a quality of something you do. They're not something that you have. A goal is something that is tangible, is a concrete, achievable event, a situation, or an object. A goal can be completed. It can be checked off. Values are very different, and they allow you to make decisions based on those values. Let's say one of your goals in life is to be a loving person. That doesn't mean as soon as you love someone and they love you, then you can check that box and you don't have to worry about that anymore. Love in that sense is a direction. It's a value. It's not an object. It's not a goal. That value allows you to make choices. Now, this is where it gets interesting, because the relational frame aspect of our brain allows us to make judgments automatically. Again, our minds are automatic evaluation instruments. Better than, worse than, taller, shorter, bigger, smaller. These are all judgments that your brain makes automatically. And your mind can justify or rationalize a choice because our brains are able to do that through relational frames. If you have a choice between two different objects, you will at some point pick one or the other, and you will convince yourself that you made the right choice while you're making that choice. Your brain convinces you of that, regardless of which choice you make. You pick any given political issue, and people will be rigidly adhering to one side or another of that, and they'll be absolutely certain that they are correct because of that mental code that they carry within their brain. And each of them are individually as convinced as the other, even when they hold diametrically opposed views. So in that sense, judgments allow us to choose anything. On the other hand, values are more of a guide that, when applied to a given choice to make, will push you in one direction or another. For example, if you are trying to get east and looking at a compass, you can look at any given moment and see if you're going in the right direction or not. If your intention is to go east, that compass will tell you which direction you should be going. And if you go in a different direction, it is by choice. Confusing sometimes a goal and a value can result in kind of a loss of direction. I talk about this when I talk to graduate students that are pursuing PhDs in psychology, and I say, you know, if the degree is the focus of your life, and it usually is for several years, that degree, if you look at it as a goal, it's an achievable event. It's an achievable object. Your graduation, which is going to be heralded with great fanfare and congratulations and a formal ceremony, that is an achievement of a goal. But that goal needs to be in service of a particular value. Why are you getting that degree to begin with? Because if you're just getting the degree to say that you've got the degree, then once you've been awarded that degree, what do you do with your life then? Now what? And I think some people experience that as they've been focused on that ultimate goal, and then suddenly they don't know what to do with themselves because they don't have an advisor telling them the next thing and the next project they need to be working on. So you have to have it in service of some particular value, and that helps decide decisions that you make about how to pursue your life, your career, and everybody answers that in their own way. So one thing that you see often in ACT workbooks and workshops involves something called the funeral exercise, and that kind of puts people back on their heels sometimes when you say, what do you want people to say at your funeral? People often don't want to think about their own funeral, but if you are able to be somehow cognitively aware of your own funeral, what would you want people to say about you? Those tend to be the values that you have for yourself as an individual. And clarifying those values is important because as long as you are aware of those values, it helps you make decisions. Now, it's all good and well to identify your values, but if you don't act on them, again, ACT, you keep hearing that come up within acceptance and commitment therapy. If you don't act on them, what good are your values? Looking at a compass won't get you to your goal. For that, you've got to get up and move. And so in the same way, having a value does not make you the person that you want to be unless you actually start moving in that direction. And that is, first off, the value, what matters, and then committed action. Do what it takes. By taking that action, you are moving toward what you value. And again, it's going to be different for every person as far as what those values are and what actions are necessary to achieve them. And there are a variety of different skills that can be taught that help make us more efficient, more effective, things that enhance or enrich our life, and then things that help us push toward the goal, these waypoints that help us know that we're moving in the right general direction. The self as context. I don't want to get too deep into the weeds here, but basically when it comes to self, you've got a self that you are defining, the one that kind of is when somebody asks you, tell me about yourself. Those are the words that you come up with. Those are the exemplars that you use to define yourself. I'm old, I'm anxious, I'm kind, I'm unlovable. If you have that last one, then you're going to be unhappy a lot of the time if you feel that other people don't really care very much about you. This sense of content is your verbal story about you and your life that's reflected in that stable verbal picture of yourself that I talked about earlier. In terms of trapping you in your suffering, this conceptualized self is the most dangerous because it's a stable story. It provides reasons for your actions and often self-fulfilling descriptors that become limitations. The self as a process is basically your awareness, your fluid awareness at any given moment of what you are experiencing. So your ability to react to the here and now. That's why we teach diffusion as part of this therapeutic process, because you need to have that level of self-awareness of your thoughts and your reactions to them. Why are you thinking and reacting in the way that you are at any given moment? And then this self as context, which is often described as the observing self. It is the least connected to the verbal code by which you define your life. The observing self is not an object of our verbal relations. It is not a content-based sense of self that can be described. As you go through your life, your body changes, your thoughts change, your feelings change, your role in life may change, but that essential sense of you that is able to independently notice and observe all those things never changes. It is the sense of context and perspective. It is your sense of self, your awareness of existence, your consciousness. That is unique to your existence, and it is the you that is separate from and able to observe your thoughts. Most people that I talk to have a sense of self that is pretty well ingrained in their early 20s or so. And so no matter how old you get, inside your head, you tend to be about that same age. Now you can acknowledge, as I do, that my body over the, well, I'm not going to tell you how many years, but a bunch of them since my 20s, has changed substantially. What I'm able to do, what I'm capable of doing, has changed over the years, and I've had a lot of years to adapt to that change as well. If I resisted those changes, then that could turn out to be a problem. Again, psychologically, it is accepting those things that are within your life unchangeable. I'm going to continue to get older, and my body will continue to change, and I will continue to have to accept those changes in order to be, in some cases, safe, and in other cases, comfortable. But the observing self, that interior sense of self, doesn't tend to change much. And so I'm pretty much the same person cognitively. I've learned new things over the years, but my sense of self hasn't really changed substantially since I was in my late to mid 20s. And I think most people tend to enjoy that time, and we tend to stay there a good bit. I want to illustrate briefly how some of these concepts and constructs are applied to the clinical setting of QLI in the standpoint of chronic pain. That pain cannot be avoided, but separating that pain and suffering aspect. The difference between clean pain and suffering. In other words, clean pain is the pain that exists, the physiological experience of pain, versus the suffering and impairment that accompanies not just that perceived pain, but also the anticipation of pain. When people talk about the fact that there are things in their life that they don't do because if they do, they will experience pain. That anticipatory limiting of one's abilities and role is what we refer to as suffering. The pain is going to exist in cases of chronic pain either way. And that's why oftentimes I will ask individuals that are considering entering a chronic pain treatment program, if you could do the things that you value, if you could do the things that you want to do, and still experience exactly the same level of pain that you experience not doing those things, would it be worthwhile for you? Is that worth working toward? I had a man one time who said, I just want to be able to go outside and throw a football with my son. And so the question was, right now you've been sitting in the basement in a recliner because you are in constant pain. If you were in the same amount of pain, but were out throwing a ball with your son, would you be doing that? And he said, yeah, if it was the same amount of pain, I would do that. We know that from a physiological standpoint, if you discontinue the use of a limb secondary to pain, the brain actually upregulates and becomes more sensitive to stimulation. This physiologically results in something we call proprioception of receptor sites. Basically, the brain is dialing up the volume with a resultant increased sensitivity. That's how you can experience a perception of pain when there's no actual tissue damage occurring, or the perception of pain in a part of the body that doesn't even exist anymore, like in the case of phantom limb pain. The brain is still there. It's still capable of creating the perception of pain. That's why opioids are ineffective in treating chronic pain. You get all of the clutter and none of the benefit. In other words, you get upregulation, you get increased sensitivity, and again, in cases of chronic pain where somebody has been on narcotic medications for years, the narcotics are not treating the pain, or else the pain would have gone away years ago. So why continue treating something with something that has been demonstrated in that individual case to be ineffective? The CDC guidelines that came out a couple of years ago actually acknowledge this and recommend now changes in prescriptive guidelines when it comes to narcotic pain medications. This over time is being reduced so that only short-term, very time-limited use of narcotics for appropriate acute pain situations are recommended. And the chronic use of narcotic medications certainly is not recommended. You get all the clutter that goes along with it. Constipation, cognitive suppression, reduced processing speed, all those are side effects of the medications. To reverse that action, it's necessary to reestablish normal function. So in other words, If you have protected a limb and not moved it, and now you've resulted in increased proprioception because of that lack of use, you have to start using that limb. And what you see is over time, the brain re-regulates to the new normal. So if you get off of the opiates and you get more physically active, what you see is you're able to do things either at the same amount of pain or reduced amounts of pain over time as your brain re-regulates to the new normal. Our brains have an amazing capacity to adapt. The negative outcome of that is chronic pain in cases where an individual has developed that physiological and psychological experience of pain, even in the absence of an acute pain signal being sent. The brain can also be retrained in the opposite direction. It takes time. It doesn't happen overnight, and it is a process that requires a lot of support and effort on the part of the individual. But the payoff is the individual ends up in less pain, off of narcotic pain medications, and moving in a direction of living a valued existence, pursuing the things that are valuable to them individually within the physical activity. In this instance is not only aligned with the values and goals of an individual, but ultimately it results in a more normalized pain response. For that reason, it has to be very individualized. You're doing this with a person. You're using their unique values. You're using their unique goals as waypoints in service of those values. So it could be a variety of different things that are most important. For some individuals, it is family. For some individuals, it's work. It's their job. You know, most individuals that you talk to about their job, well, it's, you know, it pays the rent. It gets me through the week. Most people dream of the day that they can retire and not have to work anymore. But people with injuries who aren't able to work, that's one thing that they're focused on getting back to because it's such a sense of identity. It's such a sense of self. So for those individuals that value and wish to move towards that redefined sense of self, this therapeutic process allows them to take more active control of that, to take more active control of how they react and how they experience their own thoughts moving through. So, ACT and chronic pain, our goal in working with clients, patients, residents, whatever you define, individuals, our goal is to alleviate suffering, to reduce the interference of the symptoms that are imposed on their lives, their thoughts, their feelings, and their behavior. Again, it's not trying to change those things that cannot be changed. It is focused on being able to modify the things that you can and accept the things that you cannot. ACT provides us a way of thinking that many clients can apply to their situation. But as Stephen Hayes has commented, it also allows us to test out how these approaches apply to our own thoughts and feelings. It makes us aware of our own values, our own goals, and our own choices. So again, it's mindfulness. It's being in contact with the here and now, with the present moment. It's identifying what are our unique values in our life, and are we making decisions and committed action that are in service of those values. Again, your brain has the capability of rationalizing any given choice or any given option. But if you apply your unique value to that choice, it will give you a clear direction of which choice is best in support of your value. And the committed action is actually moving toward those things that you value. The self as context, or the observing self, is that awareness. Again, it helps you be aware of the thoughts that you are experiencing in any given moment and acting on or not acting on those thoughts, being aware that they are simply thoughts. They do not define who you are. That's the diffusion aspect, being flexible from the standpoint of defusing, separating yourself from the chattering monkey that you carry inside of your head that is constantly throwing thoughts at you. Thoughts of your past, thoughts of your future, thoughts that are outside of right now. If it's a comforting thought, by all means, go ahead and make that thought a part of who you are. But if that thought causes you distress, if it causes you discomfort, if it is a negative experience when you have that thought, Be aware of the fact that it is simply a thought, and you do not have to make that thought who you are. You are separate from that experience and from that thought. Again, going back to when individuals have experienced trauma and negative experiences in their past, you will have thoughts of those. There are times in my life that I've had things that have happened that used to be when I thought of those things, I got upset. I could feel my blood pressure going up. I could feel my heart beating faster. I literally physiologically reacted to those thoughts in the same way that when we talk about lemons and think and concentrate on lemons, we have a salivary response. We have a physiological response to thoughts. Learning about this therapeutic approach and learning about the diffusion, being aware of my own thoughts, allowed me, when I had those thoughts come up, to simply say, okay, that's my brain thinking that thought. Just be aware of the fact that it is a thought. It's not happening to me right now. I'm not experiencing that. There is no reason for me to have a physiological reaction. That awareness that you are having that thought allows you to react to it differently. And diffusion is a very, very powerful tool to help us live even with those negative things that have been a part of us and made us who we are today. The acceptance piece, again, is not accept everything. It's not just passively sitting there and taking everything. It is simply being aware of those things that you cannot change. What are those things that are immutable? What are those things that are beyond your capacity or anyone's capacity to change? If you are capable of changing it, then by all means do so. Make yourself more comfortable. Make yourself happier. Acceptance doesn't mean just take it. It simply means if there is a rock in your path, go around the rock. Accept that the rock is there and that the rock is hard. Don't waste time with what we would call suffering, trying to make the rock not be hard, because it is. So that, in a nutshell, is ACT. And how it relates to chronic pain, again, is being able to get an individual to identify what are the aspects of their life that they value, and having them move in committed action toward those things, separating themselves from their thoughts, their sense of self from whatever thought their brain happens to be having. And again, the acceptance piece is separating out true pain from the suffering that goes along with it. The suffering is not living a valued life because of your anticipation of pain. As you get people living a more active and a more valued life, what they see is they're able to do the things that they value, sometimes with pain, but accepting that that pain is a part of who they are, not avoiding it and not accentuating that pain by not engaging in the things that they value. So as we in our life identify the things we value and take committed action toward those things, then every decision that we make needs to be evaluated in terms of, is this in service of what I truly value or not? If it meets that metric, it's the right decision for you. If it serves your value, it's the right direction to go. There are a number of different resources that I have listed. They are within the handouts, and so I'm just going to fan through them quickly. Stephen Hayes and Russ Harris are a couple of names that you're going to see come up quite often. And those are kind of a couple of the founders or refiners of acceptance and commitment therapy. And all of these resources are readily available. Some are available on the web. You can do a quick search for acceptance and commitment therapy and actually find a lot of resources freely available on the web as well. And with that, I would like to thank you for your attention throughout the presentation. My hope is that you've learned a little bit about ACT and maybe some tips on being aware of your own thoughts and the power that you have to define yourself individually into whatever storyline you followed to this point. You can modify that. You can change that script anytime that you like, because you have the capacity to do that. Here's my contact information. You can always back channel me with a question to that email address, or if you have questions now, feel free to type them in. And with that, I thank you very much, and I turn the mic back over